In terms of infrastructure, is there any reason why government can come out and say, well, we don't have the space to do it, or things?
No, we think the infrastructure is there. It's the will and some realignment of resources. Home care, everyone recognizes that home care doesn't have enough resources. We need more personal care attendants, for instance. You hear that a lot. We need more nurses. We need, several physiotherapists for the whole Eastern Health home care program is not enough. There will be some more allied health professionals needed. Personal care attendants, anyone who's tried to get a personal care attendant at home knows it's a very difficult proposition. They need to be paid more. We have to make, homemaking or personal care at home. Those personal care attendants have to be a valued member of healthcare and of society. And the way they're paid and the way things are right now, they're not valued and they're not respected. So there has to be more money put into that. But the savings can be achieved in other ways from the acute care system. People know how much a bed costs at the health sciences, and if we can move some people out of those beds a lot quicker, as Roger's model will show, we can save an awful lot of money for the acute care system, which hopefully will come into the home care area in order to provide that care. So there's no infrastructure. I don't think we need to build a brand new geriatric hospital. We still have to look at the amount of beds we have. We have to keep looking at the long-term care beds. We need more dementia cottages, which the government are starting to move on. We need more structure outside of the hospitals, but I think within the hospital the structure is there for this system to sort of work. It's the will to do it. And the best way to do it is do a pilot project and see if we can make sure it's cost effective, make sure it works, make sure the satisfaction is there, work out the bugs, and then this can be translated to other hospitals in the province. So even though this is St. John's centric in our approach right here, this can be moved to other major centers across the province. So it's not just strictly a St. John's problem. But obviously a big problem is in St. John's with the population we have here.
Is one of the problems maybe that people tend to get sidetracked and frustrated by the issues that don't work in the current law?
I think so. I think there's a lot of frustration. As Roger said, there's also a lot of competing demands. Every service, every group has a need for more services. We need more radiology equipment. We need more technical equipment. We need more OR space. We need more, all the specialists are becoming much more. They need more equipment. So there's a huge demand from every service. And geriatrics, or the care of the elderly, for whatever reason, has always been sort of not high on the priority list of everybody for a variety of reasons. And I think we have to make that type of care a very high priority, or the highest priority. We think it has to be the highest priority for health care in general because of all the issues we've talked about. So if we get it up that ladder so that it is becoming a very high priority, we think that'll help a lot of the other services too. Things will function much better if we can correct this problem of the 90 people a day who are languishing in acute care beds that shouldn't be there in this city. So I think we have to do something, and this was a way of starting the process to renew the whole healthcare system. As you know, the Canadian Medical Association keeps talking about patient-centered care, and this specific model is very much patient-centered care. So this ties in with a lot of what the Canadian Medical Association are saying as well.
Okay.
Thank you very much.
Thanks
for coming, and have a busy day.